Let me test you real quick. If I gave you a delegation question right now, would you actually get it right? Not guess, not assume, but confidently pick the correct answer. Because here's the truth. Delegation is one of the most tested and most failed topics on NCLEX. And the worst part is, the options always look easy. They look simple, they look safe, but that's exactly how NCLEX traps you. So today, I'm going to test you, break it down, and make sure you never miss this again. Before we start, I need you to slow down. Don't rush this, because rushing is exactly how students get this wrong. Think like a nurse, not like someone trying to finish fast, because NCLEX is not testing speed, it's testing judgment. You are the RN on a busy medical surgical unit. You have multiple patients, multiple tasks, and limited time. Which task can you safely delegate to the UAP? A. Monitor a patient's blood pressure after receiving medication. B. Assist a stable patient with bathing. C. Teach a patient about a newly prescribed medication. D. Assess a patient who is complaining of chest pain. Take a deep breath. Don't rush. What's your answer? Comment it right now. A, B, C, or D, and don't change it later. Now, before I give you the answer, ask yourself this. Does this task require thinking? Does it require judgment? Does it require evaluation? Because if the answer is yes, UAP should not be doing it. Let's go through each option slowly. A. Monitoring blood pressure after medication. Sounds simple, right? But think deeper. You're evaluating the response. That requires judgment, so this is not for UAP. B. Assisting with bathing. This is routine, this is predictable, this is basic care. No clinical judgment required. This is exactly what UAP should do, so the correct answer is B. C. Teaching medication. Teaching is 100% RN role. D. Assessing chest pain. This is critical and unpredictable. RN must handle this. Here's why people get this wrong. They see words like monitor, check, or observe, and they assume it's simple. But NCLEX is asking, what's happening after that action? Is interpretation needed? If yes, it's not UAP. Delegation is not about what looks easy. It's about responsibility. Ask yourself, if something goes wrong, who is accountable? That's how you think like a nurse. Now let's go deeper. NCLEX loves comparing UAP and LPN. UAP is basic care only, stable patients, no thinking required. LPN is more advanced but still limited. LPN can give certain medications and reinforce teaching, but they cannot do initial assessments, create care plans, or handle unstable patients. This is where people get confused. Now let's test you again. Which task can you safely delegate to the LPN? A. Perform the initial assessment on a newly admitted patient. B. Reinforce teaching about a prescribed medication. C. Develop the patient's care plan. D. Admit a new patient into the unit. Correct answer, B. Reinforce teaching. Why? Teaching new info equals RN. Reinforcing equals LPN. The rest? Initial assessment, care plan, admission. These require full RN responsibility. Here's the double trap NCLEX uses. Simple wording hiding responsibility. If the task includes decision-making, interpretation, or evaluation, it belongs to the RN. Use this cheat code every time. Stable equals delegate. Unstable equals RN. Routine equals delegate. New or complex equals RN. No thinking equals UAP. Some thinking equals LPN. Critical thinking equals RN. That's your cheat code. In real life, wrong delegation can lead to missed complications, delayed treatment, and serious patient harm. That's why this matters beyond the exam. Quick recap. UAP equals basic and routine. LPN equals limited and supportive. RN equals assessment, teaching, and decisions. If it requires thinking, it's RN. Now be honest, did you get both questions right, or did one trick you? And if you changed your answer, why? Drop it in the comments. If you want to master this, go to my profile and tap the link in my bio for my RN or PN refresher. Inside, you'll get lessons, case studies, and strategies. Check my YouTube description for full breakdown videos. You've got this.
Go to my profile. Once you're in, select the RN refresher course. You'll also find a weekly timetable to help you study consistently and stay on track, so you don't feel overwhelmed while studying. Revisit important topics. It's not just about studying harder. So if you're ready to improve your understanding and stay consistent,